Beautiful.
Shall we?
One. Let's do it.
All right.
Talk to me.
Episode 1 of what? What are we doing, Remy?
The Shant and Remy Talk. Welcome.
Yes. Well, we got 2 cameras running, so doesn't matter which one we look into.
Look anyway.
Look anyway, right? You're going to be listening to us anyway. All right. So the first thing is, what prompted us to get even recording this thing, right?
Great question.
So I think we have a lot of conversation, like since you graduated, even before you graduated, like we spent a lot of time, kind of like in a mentoring setting.
Yes. Yeah, a couple of years.
And like one of the things that I notice is that whenever we start talking about something, they're some of the best content or educational content conversations we have.
Absolutely.
Right? Rather than trying to have something scripted, it's better to actually start having a conversation in a real setting.
Yeah.
And that became a lot more natural, and people connected with that a lot more.
Just flows.
Yeah, so we decided, might as well just start recording this conversation in a more structured way, right? And we can pick a topic, we can have questions from people, we can put it out to the people what they want to hear about, and then we'll move in from there.
Absolutely.
I reckon.
That's what we're here for.
All right, so I think it needs a bit of an introduction from the both of us, who we are and what we do.
Do you want to start with that?
Yeah, I'll go with that. So the name suggests it's Shant and Remy Talk. So I'm Shant, you're Remy, right?
Welcome.
Well, my journey started is a little bit of an interesting way, because like I never had the conventional experience of going to a career counselor and sitting down and like, what do you want to do with your future, right? It was never that. So when I was 18 years old, I came to Australia as an international student through the skill migration, became an accountant. I had a double master's in accounting, believe it or not.
Yeah, I actually didn't know that.
No, it's my undergraduate was Bachelor in Commerce from Deakin University, and then my master's was from University of Queensland or Central Queensland University. They had a campus here.
Okay.
And it was in professional accounting and investment analysis. Now, don't ask me any accounting or investment advice. I'm terrible at it. All right, I have an accountant to do my taxes. I don't trust myself doing my own, taxes. But after 9 months of doing that work, I just had enough of it. So I just decided to sign up in the Army, in the Australian Army. The reason for it, I was in Air Force school back in Bangladesh, and I really liked that setting. The discipline, the structure, the physical activities, and the demands and all that. The camaraderie of your brotherhood and all that. So the Army just seemed like a natural process. I just always wanted to do something like that. So I just literally in my suits just walked into this office in Swanston Street in Melbourne and just signed up for it. And can't really say I was a very good soldier, because I got injured a lot. Right? Because I never trained for it. I never understood, what training for tactical employment looks like. So I just went off the cuff and had a bunch of injuries and a bunch of surgeries. To a point, I got medically discharged.
How many surgeries did you end up having?
11 surgeries. And recently I had 3 other different surgeries, but they're more to do with tonsillectomy and all that. So I wouldn't consider them as musculoskeletal injury type of surgeries. So if you're tallying up, all up, I have had 14 surgeries in my lifetime.
What was the time frame like between those 11 surgeries that you had?
Well, the very first one started with an incident where I had a shrapnel got stuck in my knee and severed a tendon. But I was very lucky that the shrapnel missed my femoral artery, and then it just had a very clean cut and lodged into the bone. But from there onwards, the surgery, it was necessary surgery, right? Because they needed to reattach it. But the problem happened from there onward was I didn't understand about movement dysfunction. They attached it, we do a few tests. Can I extend my leg? Can I do a leg press? Can I run? Yep, fine, off you go. Yeah. Which is very common across most industries, not just tactical.
Which we'll get into as well.
Yeah, we'll get into it. I'm sure we're going to be talking about it for a while, about that stuff, right? And so from there onwards, I started having a lot of hip issues and low back issues. So I had, what we call the clean-up surgery. So I had a bunch of that. So I had one of those in my left knee and then my hip. And then I fell and dislocated my shoulder. And that shoulder dislocated 3 times in a row, where I lost a lot of function. So that required surgery. and that required a couple of surgeries to correct it.
Yeah, wow.
And then I tore a couple of ligaments in my elbow, so that needed surgery. So all up, put it together, it was just follow-up surgeries and clean-up surgeries, and
Yeah, wow.
yeah, it's just tallied up to 11. The one thing I was very lucky not to do was a low back surgery. And the reason for it, because my injury was so bad, I could not walk. I had to avoid stairs at all costs. And, I tell this story in a lot of the seminars that I do. Like, I had to dig a hole in my backyard because I couldn't go to the toilet upstairs because that's how much pain I was in, right? And interestingly, like most infantry soldiers, what you do back then was you become a personal trainer because you have some experience in training. And back then, in-person personal training was massive, right? If those of you old enough to remember the show Biggest Loser, right? That exploded that whole personal training industry. So everybody was just becoming personal trainers. Yeah. Now, as part of that process of studying personal training, I was working in a gym called Body World Gym in Balaclava. It's the history of the gym goes back about 70-something years, right? And somebody suggested me to go see this guy, Andrew Locke. He's an amazing physiotherapist. And my view was like, I've already seen everybody else, might as well go see Andrew, what have I got to lose, right? And I remember within 20 minutes, he got me squatting pain-free. It was not the most optimal squat, but it was way more than I have been able to do after 11 surgeries. And the way he approached the problem, and then the way he solved the problem, it just resonated with me so deeply that within that 20 minutes, I realized this is what I want to do with my life. So back to the point, I never had a career counselor tell me that I should become a physiotherapist or an exercise scientist or get into the world of rehab.
Yeah.
Right? It was that one moment, Andrew changed it for me. And I literally told him in that same consultation that this is what I want to do with my life. And his response was that, what a wonderful idea. You can be the person that you needed back when you got injured. And, like every now and then we hear those simple words, but they had such deep meaning.
Yeah.
Like that, it just grabbed me. Like it was, like to me, I was like, holy shit, you just said exactly what I wanted to feel. Like I needed something like back when I had my first surgery, right? So from there onwards, I just started following Andrew because I used to work at the front desk at Body World Gym as a receptionist.
I didn't know that. There you go.
Yeah, that was good 14 plus years ago now.
Wow.
Right? And I used to know when Andrew would train because I could see the check-in times. So I would hang around the gym around those times just so I could see what he's doing. I would kind of follow him around, try to be a little bit, stealthy.
Fanboying just a little bit.
Yeah, probably borderline stalking. And every now and then when I would have a question, like I'll wait for him to finish something, and in between sets I would ask him questions. And one thing I've never done, I never wasted his time. The moment he said something, I would write it down. I would just go into that deep delve research. So from there onwards, whatever he saw, he kind of took me on board and he just got me doing things, right? My first task was coloring anatomy books. Did that for 2.5 years nonstop, right? Just coloring anatomy books, just understanding muscles and bones and structures. So that's kind of how it started, like that inception point. That's, Andrew started it for me. And it's fitting that we're sitting in front of all his, accolades and all the people he has helped in his lifetime until he passed away last year, that, we are presenting this episode 1 as a tribute to Andrew.
And it really is a tribute to him because in a different sense, I didn't meet him in person until I think it was 2020, so about 6 years ago now. But he was the reason why I picked up what I wanted to do, in the same sort of realm. Back when I was finishing up in school and I was pretty heavily into my competitive rowing at the time. And
so you had a rowing background?
Yeah, rowing background. That's what I was doing from about 15 years old till about 18.
Right.
We took it seriously at the time, rowed at the Nationals, got to row nationally in Sydney a couple of times. Great experience, but one of my coaches at the time is an ex-Olympian. His name's Sam Locke.
Right.
I still keep in contact with him now.
Nice.
And Sam was the biggest guy I had ever seen in my life. And I think everyone, especially when you're young, from about between 15 and 17, you always have that one guy at your gym that you look up to. That you're like, he's massive, I want to be like that. Sam was that dude. Held the 1 kilometer ergo world record, I think at the time.
No.
On the Concept 2 erg. Anyway, when I wasn't particularly that crash hot at cardio when it came to my 10-year rowing, but I was always one of the strongest in the boat. And Sam, who recently at the time had gotten into powerlifting and got into lifting, took note of that. And I remember he had a conversation with me one day and he told me, you remind me a little bit of myself when I was younger. And that was a moment for me that really...
It's a trigger.
It was a trigger. I just felt so giddied up. I felt so giddied up at the time. And so when rowing finished, I was like, I want to be a powerlifter. I wanted to get into lifting. So I was 18 years old at the time.
Was it powerlifting or is it more lifting than powerlifting?
It was squat, bench and deadlift.
Right.
That was my love.
Right.
My passion was I want to squat, bench, deadlift. This was 2019. So I'd be sitting in the main hall at my school at lunchtime when all the other boys in my year level were out playing footy.
Yeah.
And I'm watching videos on YouTube and I'm watching videos of the Lily Bridges.
Yeah.
And I'm watching all these videos and this name came up and it was Andrew Locke. Andrew Locke and Sebastian Oreb. And so from 2019 all the way throughout my year 12 tenure at 18 years old, I was obsessed with watching videos. And oftentimes these videos would be at Pro Raw Gym.
Right.
Andrew's videos, Bass's videos. This was what I wanted to do.
Yeah.
I was like, that's it. I want to be big like these guys. I want to learn how to rehab the musculoskeletal system.
Yeah.
But it was the personality that Andrew had as well. And he just didn't care what people thought. The personality that he had. And from there, that was it. That was it for me. So I finished up grade 12. I decided, the qualification that I ended up going with was my pathway into it. And it wasn't until 2020 when I actually went for a consult with someone at the time and met Andrew at the gym. And again, that was just my gateway into the world. And like you working at Body World, I ended up working at Pro Raw Gym.
Pro Raw Gym,
And that's when I met you. In 2021.
Yeah, because Andrew and I used to practice out of Pro Raw Gym for a few years.
So you guys had seminars.
Yes.
And I would, like you stalking Andrew, I would stalk you guys at the seminars because I'd be working at the front desk and I'd be taking little peeps.
Yeah.
So in a sense, different context, but Andrew, which then led me onto you, has kind of been my gateway and my sort of lead into the world that we're now in, and very much not just a role model that I look up to, that you look up to, but the way that we practice, the way that we conceptualize things and think about the musculoskeletal system. Very much a pioneer of his beliefs, his foundations. So in a sense different, but also the same too.
Yeah, awesome. It's that we all have that something in us. We don't know what it is until we get a spark from the outside. And then all of a sudden we realize that's what it is. Yeah. Right? And I think in any profession, that's the best way to get into that profession because this is not a career for you anymore. It's a passion, it's a love. Absolutely. You're going to be able to stay with it for a very long time. You're going to be able to do some long hours without feeling like they're hard work. Yeah. They might be challenging, but it doesn't feel hard, right? Because this is exactly what you want to do.
It's what you love.
And I was, in a way, I was a late bloomer. Like I figured that out in my late 20s. When I first met Andrew, right? And interestingly, the career pathway wise, if we were to describe it as a bit of a job description, right? The interesting thing is, even though I wanted to be like Andrew, and Andrew had a very interesting way of curating at least my career, right? He would never say what he wanted to say. He would never say, do this, do that. He would just say something in passing, and it was up to me to figure out what I can extract from him and how do I use that information for my own development. He always wanted me to make my own decisions because he was a big believer of self-determined decision making. Yeah. Right? Meaning I have to figure it out on my own with the information that he has given me and figure out what do I want to do with it. So we were talking about it, and his view was that if you do not understand strength and conditioning, then you should not get into rehab, because if you do not understand human movement and human performance using those movements, how are you going to fix somebody? You're going to come across somebody who has a very athletic background, but you do not understand it. How do you even know what that person needs?
Yeah.
Right? And that was the fascinating part, which is I got into strength and conditioning first. I was an ASCA level 1 coach, and I did a bunch of job through that. And then building on my anatomy coloring book, the next phase for him was manual therapy is definitely not a way of we solve problem as the only means of solving problem, but, fire trucks. Well, the way we solve problems is how we understand anatomy. He was big on anatomy is your currency of rehab.
That's your base.
Right. So I got into, I became a qualified AFL sports trainer. It basically means you're qualified to be a manual therapist within the AFL system, and I worked with a few different clubs. But while I was doing that, all I was doing as I was massaging people, I was naming the muscles. I was trying to remember the origins and insertions, what their functions were, because that's my currency. And I did that for a year or so, and I got really good at it. Just by palpating the muscle, I knew exactly what they were.
Yeah.
And by working with so many different athletes, you realize the little variances. Like some people have very well developed adductors. And you've done manual therapy as part of your education, and we'll get into that. You can feel the tone of the muscle and the difference between those different people.
Learning how to use your hands in that way is...
Yeah, right. And he mentioned something like one of the best manual therapists he mentioned was he was actually a partially blind guy. So he couldn't see, so he was heavily relying on his hands.
That makes sense.
Yeah, because he was so good at palpating things and figuring things out what this muscle was. And the function of that muscle and the tone tells us so much of the story. So that was my next progression. So I was already a qualified personal trainer and a strength conditioning coach. Then I was and
then you went into
the sports training.
Sports training.
Now from then onwards, as I was working with a few different clubs, then we started discussing about my university degree, what I was going to do. For whatever reason, Andrew doesn't have a lot of, I would say, passion for the title physiotherapist. So I suggested maybe I should go, study physiotherapy. And his response was, might as well go fuck some unicorns at the same time. That's his way of saying.
So what a character.
Yeah, and if you spend enough time with Andrew, that's his way of saying, maybe you got it wrong. Maybe you need to look into other avenues. So I got into exercise and sports science. And at that time, Deakin University had one of the best programs because they're involved in a lot of sporting clubs, and they had incredible facilities both in their Burwood campus and Geelong campus.
Yeah.
And they're working very closely with the Geelong football cats, so where I did part of my internship as well, right? Some working hours. So exercise and sports science was the first thing that I did, and I graduated from that. And then I moved into my master's again. Instead of going through the route of physiotherapy, I chose to go through master's by research, because his next view is that it's very important to understand research papers, the process, the life of a research papers.
Yes.
What you see on paper is just the end product. It's important to understand how a research is conceptualized in a board meeting.
Very important.
And how we create the scope of that research, how we choose the population, the intervention, controls, outcomes, all those things. It's very important to understand, and the best way to understand is being involved in it. So that was my master's in sports science.
Yeah.
And doing that, I just put my hand up to any research project that was on, and ended up being co-authored to, I think, about 5 different papers.
Yeah.
Right? So if you put in my name in PubMed, you'll find quite a few papers, which is a pretty cool thing to say, And as a result of that, I also had an honorary, PhD degree, but I never used that title, doctor, because to me it's a little bit wanky, right? Not saying anybody who uses the title is a wanker. I'm just saying for me, I just felt I'd never used that title, right?
It is a bit.
So that was kind of like my, educational qualification. But even within that, another advice I had from Andrew was, say yes to everything. This is my learning. I got to pay my dues, whether I get paid or not. So I pretty much said yes to everything, right? So I did pre-game activation for the Melbourne Vixens. I worked with, like I said, a few different AFL clubs, and I worked with different rugby clubs. Then I worked with soccer teams, and then I worked with, I think that there are a few other sporting organisation. Oh, I also did some grassroots football, AFL football development down in Sunbury, which was like a 2-hour drive back and forward each way. Right,
Yeah,
so, and
wow.
AFL has a very good grassroots development program
Yeah.
for their young athletes, and I think that they do it the best than any other sport here in Australia, at least.
Yeah.
So, like having exposure to so many different sporting organizations and sports and different cultures and how the system works, getting used to that, that was such a vital experience in my development. So now when I work with athletes from different backgrounds, I understand what that culture or what the system looks like. I know how to monitor or modify my program, how that's going to be able to fit into that system.
Yeah.
Right? And for myself, being in the army was my athletic experience. Being in the infantry is a very physical job, so there's a lot of physical training. And I also did a lot of boxing. There's a very good boxing coach called Christian Enna, and he was, I think, the coach of Sam Solomon at one point.
Right.
So he was my boxing coach for a while. And then I did some Brazilian Jiu-Jitsu because I started working with a lot of fighters through Andrew. So I needed to understand Brazilian Jiu-Jitsu at Elevate MMA with Daniel Kovacic. And I competed in powerlifting, right? That was the first thing I did after seeing Andrew. I started competing in powerlifting. Now, my numbers are not impressive, but from where I came from to what I was able to do within a few years, that was a testament to
The
what is
progression of
possible.
Yeah.
Right? And I did not pick up powerlifting in my teens or early 20s. I picked it up in my late 20s and 30s. And I was able to do fairly well within what I was capable of at that time. And back then, the numbers were not as eye-wateringly impressive as you see it
It's getting
now.
a bit crazy now.
It's like it's getting to a point. It's just like 300 doesn't even feel like anything.
300's the new 200. Genuinely.
Yeah, like, or maybe 180. Right?
Yeah.
I remember the first time I deadlifted 180. I thought I was the King Dick. So. So Brazilian Jiu-Jitsu and and I also doing some group training in Body World Gym, so I had a bit of an understanding how that works. I did that for a couple of years. I used to run a boxing class for a couple of years in Body World Gym for general population.
Oh wow!
Yeah, so that was such a varied experience, and it was always somehow, some way curated by Andrew because he wanted me to have as much exposure to the world as possible, paid or not. And he always used to say, "You're gonna get paid later. You gotta pay your dues first." So that was kind of my work experience, but also my personal journey in different sports myself. Yeah, and you started with, you said, rowing when you were 15, and then powerlifting, and I was a little bit involved in that process for a while as well.
Yeah, correct. You were. So as from a really young age, I was into martial arts when I was probably up until about that early adolescence, teenage sort of years. And then rowing was what I took. That was my first serious sport.
Right.
Like that was 4 or 5 times a week
Competing
training.
at national level,
I was on the water at 4:30 in the morning and then back at the sheds at 6. So that was elite. It was regimented. Not to say that my results rowing at an elite level, but how I took the sport and what that ingrained in me, not just with physical capabilities, but also the discipline to show up, the discipline to put the work in, which is something which relates so closely, not only to other athletes, but the rehab process in and of itself. So then when that finished up, and then my entry into powerlifting, which is probably something which I took even more seriously.
Yeah.
And I've been able to really work hard at that and achieve some numbers, which again today mightn't be so impressive compared to the Colton Engelbretts of the world. But to be able to say, as a clinician, I can bench press over 200 kilograms, deadlift over 300, as a natural athlete as well. That's something which I think gives a little bit of validity too. And also something that I really stand by is that if I'm going to listen to someone's opinion, you can read all the textbooks you want, but where is your skin in the game? That's something that Andrew had. That's something that you have. That's something that I have. And you can't fake that. You can't fake that at all. And then now, I'm still doing my training as well, but getting back into a little bit of the martial arts as well. I love Muay Thai recently got back from Thailand, did a training camp. So understanding how to apply across different sports, and I've worked with rugby athletes, I've even worked with runners, professional jockeys, a multitude of different athletic profiles that I've seen. A, it's so cool, but B, it also helps in a sense that I've worked with different people so I can understand the sport a little bit better, but it still relates into strength, into neuromuscular control, into how we move. And that is still the basis of the pyramid, which everything else just compiles on top of.
Yeah. Like one of my interesting experience was with the AFL umpires here in Victoria. For those who are not from Melbourne, probably not familiar with AFL as much, but it's one of the biggest sports here in Melbourne, probably in Australia. I was the strength and rehab coach for the AFL umpires for a couple of years.
Yeah.
And one of the things that we noticed, and kudos to the strength coaches there back then as well, by introducing strength training and proper activation protocols before going onto the football field, it made such a huge difference, not just in the performance, but injury prevention.
Yeah.
I don't remember the exact number, but we had a ridiculous drop in injuries by the second year.
Yeah.
It was huge. Like it was quite a phenomenal difference it made. But I think one big takeaway is for the both of us is if you do not understand what it is required to train like a professional athlete, it's very difficult to work with them, right? My other job was with Bruce Gray, who's my another mentor other than Andrew Locke. We used to be the strength coach for the Melbourne Boomers and a bunch of NBA athletes in Body World Gym. Working with them and training with them, because Bruce was a big proponent, you gotta do what they're doing too. The coaches had to train as well as the athletes, because you have to understand what you're putting them through. So you being a national level professional athlete, professional doesn't always mean you're getting paid for it, but that's your livelihood in a way, right?
Yeah, it is.
If you do not have that inherent understanding, what is required to operate at that level, it's very difficult to have a very successful profession moving forward in that field.
Absolutely.
Whether it's strength conditioning, whether it's rehab, whether it's performance, whatever it is.
Yeah.
You have to have some skin in the game.
You got to walk the walk.
Yes,
Yeah.
absolutely. And then from moving forward, so I did my qualification in exercise sports science, and yours was
Osteopathy.
Yep.
Yeah.
Right. Yeah, tell me a little bit about that.
Yeah, so that was 4.5 year tenure. I think I extended mine over 5.5. Actually, this is something which I'm not even, because we all have ups and downs in life, I'm not even embarrassed to say this, but I was so dedicated to my powerlifting at the time. I was competing at Pro Raw 12 sleeves. I was 21 years old.
Yep.
This would have been, about 4 or 5 years ago now. And we had a particular subject at the time, which was all about visceral anatomy, right? Which a lot of it was fantastic and obviously very important, but at the same time I was very focused on competing, and I was like, I don't want to learn about the genitourinary system. I just want to go to my deadlift session, right?
Yeah.
So I actually failed that subject by 0.2 of a mark at the time, or 2 points, and so I got set back a year. So it took me 5.5 years once at the time I was fully out of university, but in hindsight, that's actually a fantastic thing that happened to me. And I can say that I did it because I was so focused on my athletic pursuits, but also gave me the time to really consolidate knowledge and learn and build even more, and able to, in my final year, be able to do mentorship with you, be able to watch you and learn. So it's actually worked out really well, but that was what I chose. Osteo was the path for me, but much to that point that you brought up about Andrew and his view on the physiotherapy sort of world, is that I don't like to hold myself to a name.
Yep.
Because I do not in any way, shape or form practice like a traditional osteopath.
Yep.
There are elements which I will use, and I do, but we're not limited by a name.
Yep.
That's not what we do.
Yep. Like Andrew used to say to all the new graduates, now that you have graduated, it's time to lose your religion.
Lose your religion, yeah.
Right, and not in the theological sense, but don't attach yourself to a title. I learned so many things from so many different professionals with all the different work experience that I had. That I sometimes struggle to tell people what I do. My title is exercise sports scientist, but when people ask, what do you do? It's difficult in a way to explain what do I do. So I kind of say I'm a movement specialist.
Yeah.
Because movement is the world that I work in. When people come to see me, they have a movement problem. They may give me a diagnosis, but ideally what they're experiencing is a movement deficit or a movement incompetency, right? So back to the point of not attaching yourself to a title or the scope of that title, you're actually, you're not doing yourself any favor by doing that.
No, not at all.
Right? And Andrew used to say, like, he worked with a chiropractor who taught him how to read scans better than any university, subject that he had done. That didn't mean the chiropractor was probably the best at fixing problems, but he was just very good at reading scans.
And a really good point there, because just off that, you can also learn something from anyone.
Yeah.
Some people who, they will take your degree or whatever your chosen field is, and they will take it as gospel. I know, fantastic. I've met strength coaches who are so knowledgeable, people who don't have any degree at all, but there's some things that they know that they are so good at. You can learn something from anyone.
Yes.
Absolutely anyone.
Yes. And everybody has, and sometimes you can learn from anybody by watching what they're doing wrong. So you know what not to do, right? And, I have a fantastic individual that Andrew introduced me to, Dr. David Johnson from Queensland. He's a neurosurgeon. Another one of my very close friend who started as my client, Dr. Diego. He's trauma orthopedic surgeon.
Yeah.
And just working with them, and there are a few other neurosurgeons and neurologists I work with in America, watching them, yes, I don't agree with a lot of the things that they do as an intervention, but the way they look at problems, the lens that they use, I'm learning a lot about how the medical system works.
Yeah, that just broadens your breadth.
Correct. So now when I'm working with surgeons, I understand the lens they're looking at the problem from, so I know how to approach that, right? Just shutting people off, saying, oh, he's an idiot, or I don't want to work with him. Well, you're going to limit yourself. You're not going to be able to run a business.
Yeah, and that's a big problem with, I think, and that's something that we'll touch on later, but the whole world of where we sit on some side of the equation of some issues and other people sit, and it's almost like this back and forth dialogue.
Yep.
And it's very black and white and nothing about what we do. Well, a lot about it is, but then also a lot of it can be applied in different ways. Nothing is truly black and white.
Correct. Like, you don't want to get yourself married to an ideological tribe. You didn't pledge an allegiance to any of them.
No.
You've pledged your allegiance to your client. And again, one of my very early on lessons from Andrew was, no one cares how much or what you know if you're not making a positive impact on the person sitting in front of you. It's all pointless. So that's why, I think neither of us really get involved in any Instagram squabble, because
apart from the occasional hero.
Maybe. It's sometimes it's fun, and Andrew used to do that for fun as well, just for a good laugh. But it's like, to me, it's not about semantics and word salads and see if I can win a comment section argument.
Absolutely.
My commitment is to the client, because I know what it is like to be failed by the healthcare system. I'm a very good example of that. So I have no interest in winning an Instagram argument. My commitment is to the person sitting in front of me. They have paid in a decent amount of money to come see me and taken time out of their day. So I have to do everything within my power with the context that I have, and my context has to be airtight, right? To make sure that the person is walking away with exactly what they wanted as an outcome.
One of the first things you told me was that hour and a half you're with that person, that is the most important person in the world. Nothing else matters.
Correct.
That's always stuck with me, actually, since you told me that.
Yeah, and that's something I learned from Andrew. For that hour, or like my consultation, I allocate roughly about 90 minutes per consultation, because an hour is not enough. It's never enough for me because of the details we get into. And I think that's something we should talk a little bit about, our consultations.
Yeah.
Right? It's that person has put everything aside to come sit in front of you. You are pretty much, in a way, going to save that person,
Yeah. Yeah.
right? You should extend the same courtesy to that person, because to them, you are the only person there in that consultation.
Yeah.
So for that 60 minutes or 90 minutes, the world does not exist. The only thing that exists is the person sitting in front of you, and all your cognitive abilities and capacities should be dedicated to that one person. Once it's finished, okay, full stop, move on to the next person. But whatever's happening in your life, it's irrelevant. What's happening in the social media sphere is irrelevant.
Undoubtedly.
Right? And again, not getting married to ideologies. Everything, we see it from a critical point.
Yeah.
We analyze it. We not just take something at a face value, but the end outcome is, how can this be beneficial for my client? And a new field that I got involved with in EDS and hypermobility in 2019, 2020, because Andrew introduced me to Annie because of her sacroiliac joint problem. And at the time, I didn't have much experience with hypermobility and EDS. Now, I did not try to impose what I knew on that field. I went in and I realized there's a lot I don't know. And I need to help these people, because these people don't have a big community of clinicians that can help them. So I had to put in a lot of time and effort learning, working with these people, researching and figuring out what to do. Now, even within that field, there's a lot of noise on different sides of the spectrum.
Definitely.
This is the only way, that is the only way. And the reason, I was very interested in working with you, was you didn't have the mindset of that binary mindset, either this or that. There's a gray area, and we're not married to one single ideology.
Absolutely.
It's all contextual. What is the problem? Let's identify the whole scenario, and then we're going to come up with a solution based on that. Not, I'm going to try to fit this person into this category, and if it doesn't work, then I'm going to blame the person. That's my shortcoming, if I don't know how to solve that problem. Now I have to go out and figure out what we needed to do.
Yes.
And this is something I really enjoyed working with you in that mentorship scene. Like, whenever I said you should look into this, you always had those big notebooks that you had. You used to come into the consult. Yeah, you always just had this thing. So how, you've been an osteo for how many months now?
A year.
Yeah.
I've been practicing for a year now. Yeah.
No shit. All right. Well, how does your consultation look like now?
Yeah. My consultation, much like you in a sense, I think 60 minutes is not enough. And so my initial consultations, similar time to you, 75 to 90 minutes.
Right.
I think the maybe the difference between at least your clientele now and mine is that I see a lot of acute presentations.
Mm-hmm.
Like, I will very often have someone walk in the room with me.
Mm-hmm.
They are in severe pain today. They've done an episode, whether it's a low back, whether it's a neck, a shoulder, whatever, 2 days ago, 48 hours ago, at max a week. So that can change a lot of things of how I can help a person in the short term. And this is where the manual therapy part of my practice does still exist, and I still do use it.
It's a very useful tool if you know how to apply it.
It's a very useful tool for the right person at the right time.
Yep.
And the problem that I have, and one thing that I never wanted to become, was a rub and click or rub and crack clinician, which, learning some of the business side of the industry now that it's been a year, I can see why people end up going down that route to become financially somewhat stable or secure, but I can never get around the fact of rebooking people for absolutely no reason, or for actually providing something which, look, maybe it gives them somewhat of a benefit today, but are you really solving a problem for them? That just doesn't sit right with me. So it's a skill that I use. I think it's a very valuable tool in the toolbox, but it's a tool in the toolbox. So yeah, in terms of what my practice looks like, I have a bit of a longer first initial consultation, and then depending on where the person's at, depending on their goals, and that's really the second question that I ask someone. First is, what's your problem? And second of all, what's your goal? That then leads where we head to next. And what that looks like for the individual might be very different. Some people might see me a few times, some people might see me once, and we're good. It all is based on the individual. But again, I think a longer time frame, because you need to get to understand and know the person. You need to get a buy-in. You need to understand their problem, which is unique to them.
Yeah.
The Maitland approach was something that you
Yep.
brought up with me initially.
The Triple M I learned from
Triple
Andrew,
M.
Mackenzie, Maitland,
And McGill.
And McGill.
Yeah, but mental agility.
Yes.
That's something which I've taken on, and probably is, again, I mean, it's the basis of how
You
we
have to have
practice.
that inquiring mind and the mental agility to understand what the problem is and
Yes.
why something hasn't worked and what needs to happen to make it work.
Correct,
Yeah.
correct. And everyone, something that I preface too with people who sit down with me, I say, everyone wants to get out of pain.
Mm-hmm.
That's the obvious part.
Of course.
And in a sense, it's almost the easy part.
Yeah.
What do you want to do? What do you want to achieve? What can't you do that you want to be able to do? I've seen 80-year-old patients who literally just want to be able to get out of a chair, and I've dealt with elite athletes. Today I've been rehabbing a guy who's fighting in one championship.
Nice.
Literally just got a knockout and he's fighting again in 5 weeks.
Right.
So the breadth of the people who I've seen is exponential.
Yes.
Exponential, but it always comes down to what do you want to achieve? Now let's work that plan backwards.
Yeah. Yep. And, like you said something about pain. Yes, I understand, pain. Andrew used to say there are two great motivators in the world for human beings, pain and pleasure. People will do anything to avoid one and go towards one. And for some people, pain is pleasure, but that's a different story, right? But yes, we understand when someone comes to see us, pain is what happened for them to decide that I need to go see somebody to do something about it. Until pain, they don't really notice what the problem is, right? And this is my approach of educating my clients. Well, let's start with the process, right? So somebody comes to see me. The first thing is it starts with a very detailed subjective, right? Take your time, really spend time with that person, whether it's 60 minutes, half an hour, whatever is required, to really understand the story of the person. And I'm pretty sure you've experienced this as well. The amount of time these clients tell me, and I'm sure you've experienced as well, is that this is the first time someone has taken this much time to listen to all the things I had to say, and I feel validated for somebody actually just listening to me.
Yeah.
Like, this is what I have to say, as opposed to just dismissing it, it's all in your head.
Which is a shock.
Yeah.
Because, and especially as someone who's been in the industry now working for 12 months, it's like, you shouldn't be telling me, you shouldn't be telling me that.
That should be the norm.
That should be the norm.
Yeah.
But I had a patient the other night and chronic pain, years and years of unable to do things that she wants to be able to do. I sat with her and tried to explain a concept with her for 15 minutes, and she was just 15 minutes during our consult. She was like, no one's ever explained that to me like that before. That makes so much sense. But it's almost like a critique on the industry in a sense.
Yes, like I said, I've experienced what the other side of the healthcare system can fail somebody, right? And that was my experience, like I go to see an osteo, they'll just do a quick 15-minute manipulation and then off you go. Or if I go see a surgeon, I would never see the face. I would just see the top of their head. They're just sitting down and then just writing a bunch of notes on their laptop or whatever it is.
Yeah.
And then, let's book you in for a surgery.
Yeah.
Right? Not much history. Like, the whole consultation was 10 to 15 minutes. Lucky if it was 20, right? And this is the sad part. And that's why, we both, modeled after Andrew, which is long conversations. That will give us so much of the background of the person and the story of the person that a 10, 15-minute consultation is not going to give us that.
No.
Right? And the subjective, it tells us a lot of information about the unique variables of that person. A tennis player with a low back pain can present maybe the same as a powerlifter, but when you actually go into the depth of that subjective conversation, you'll notice the different variables. You'll notice the different demands of those two sports.
Oh, yeah.
It may sound obvious, but for some reason it's not for a lot of clinicians. And that's the most surprising thing. And I present so many seminars with Andrew and also Sebastian Oreb. We've done seminars with the Defense Force. And one of the big things is that understanding that detective skill of extracting information from that person during that subjective.
Yeah.
So when somebody's sitting in front of me, I will take my time and do my detective work and writing down history of that person, how it happened, when did it first happen, tell me a bit about it, what do you experience? And the education part of it is that pain, you may have experienced pain at that one point in time, but that's not how it started.
Yep.
It resulted in that pain. That's an outcome. That's a consequence of whatever's happening.
It's a symptom.
It's a symptom. We're not here to fix your symptom. The pain will take care of itself. We need to fix the cause of the pain. Pain is not the cause. It may be the cause for you to come see me, but the problem that you're experiencing, the pain is not the cause. It's a symptom, it's an outcome.
Absolutely.
I need to go behind the curtain, like the Wizard of Oz, and find out what's happening behind the scene for that to happen.
What drives the response?
Yes, and then there's so many, physiological and physical tests that you can do. But if you're very good at your subjective, you're gonna be able to figure out exactly how many tests and what tests you need to do.
Yeah.
So you don't have to spend an hour doing 10 different tests hoping something happens.
Yeah, absolutely.
And then your intervention becomes very, very precise. So when someone comes sees me with the subjective interview, okay, I have a very good idea where this is going. I have the pattern. I have recognized the pattern. Now I'm going to do very specific tests to make it one-to-one match with what you have just said. Okay, the test confirms what my hypothesis was. Now I'm going to apply an intervention, whether it's, in my case, I don't do any manual therapy. It's generally physical activity work. Okay, let's do this. Let's retest the pattern again. Okay, it's better. Good, my hypothesis is correct. Hypothesis, test, and retest. All right, move on to the next one, move on to the next one. And then by the end of the session, we have a protocol that the client can get away with and practice every day. It may have to do with activations they need to do before their training, or it may be the only thing they do for a while, or there might be some life strategies with good movement habits that we instill for that person.
Yeah.
Do you experience that same in your consultations?
Very much so, very much so. And this is where the dynamic of who you have sitting in front of you can change a lot of things. And I find with the breadth of types of people that I've seen, all different demographics, as I said, elite athletes, I've seen third trimester pregnant ladies, I've seen just an absolute crazy, breadth of different types of people, and you have to be actually quite good at deciphering that information and leading things. Otherwise, you are just in the dark.
Yeah.
You really are.
Yeah, and again, if you understand, I had a recently a 37-week pregnant client in her 30s, did a 120 kilo deadlift, 37 week, which she hasn't done in a long time when she was younger, and training for powerlifting. This is the second time she has done something like this. At 37-week pregnant, no discomfort, no pain.
Awesome.
Right? But again, understanding the story of the person.
Yes.
Figuring out. And
you
were my client once.
Yes.
Right? And we spend a lot of time actually just sitting down and figuring it out, your motivation. What is it that you want to do? We do a little bunch of movement tests. Then we did our activations. We retested the movements. Everything has to be precise.
Correct.
And the result was, and you and our good friend Patrick, you competed in the same competition, and you have the bragging rights forever.
Him.
Yeah, I told him, and you won number 1, and he was number 2.
Yeah.
So I'm sure he's going to see this podcast. And that was the outcome, and you got to experience that yourself as a client. So now you can pass that on in your practice.
Yeah.
You know what that feels like.
And it's so important that I went through that. It's so important that you've been through what you've been through, because then when I tell someone and I show them the way of this is what we're going to do, there's a next level of understanding behind it.
Yeah.
When I have you on the ground and we're going through this activation protocol and you're losing your mind because it's tough, because it's hard work, I get it, because I've been there. I've been there. But if you can do it, if I can do it, then they can too.
Absolutely. right? And I remember, like, when you first came to see me, you couldn't walk out with
I
that
was
20
broken,
kilo.
man.
Yeah, you couldn't walk out with that 20 kilo bar.
I had to pull out of a national level comp, which I was so excited to do. And to give a bit of context, at this time, obviously numbers were a little bit different. As we've said, the sports progressed quite a bit. But being a young and probably a bit of a dumb kid, I thought I was crash hot. I was sponsored by, certain coaching businesses that are pretty well known in Australia. I was competing nationally. They were making YouTube videos about me. You're that young and you think you know it all.
Rightfully so.
And then you get hurt.
Yep.
And then being pulled out of that pit of shit is a process. But again, so glad that in hindsight now that gives me perspective to be able to then help other people.
All right. I think we can go more in details about assessment process in a different episode.
Yeah.
But before we wrap this one up, what's moving forward on for future?
What's moving forward on for future? Well, I've recently just launched my practice. I'm working out of a beautiful clinic space in Hawthorne called St. Serene with our lovely friends.
Yep.
And that's where I'll be practicing out of for the foreseeable future.
Yep.
And yeah.
And that's the focus. Your first year in the industry.
Yeah, it's been a crazy hectic year. There's been a lot of learning, a lot of growth, and I think it's just going to continue to perpetuate and get more and more and more. And I'm here for the journey.
Nice, very good.
What about you?
Well, I practice out of this space, Uplift Gym, and also practice out of Body World because that's how it all started. The OG,
the Mecca.
Yep. I don't practice as many days anymore because my focus has shifted back into the education side of things.
Yeah.
So I'm developing a mentoring program and...
Really exciting.
Yep. Because again, it started with everybody asking me about mentoring program.
People were asking me about your mentorship.
Yes. Well, that kind of prompted me. So with Andrew's passing, unfortunately, last year, like things kind of, it was, in some way, he was my safety net, right? So it's kind of like now, I don't have Andrew a text message away.
Yeah.
So I have to, figure out. And one of his, without going into details, one of the very last conversation 3 weeks before his passing was, he has a mission for me. And part of that is continuing his legacy, right? And I think the best way to do that is through educating people why he was such a successful person.
Absolutely.
He had, obnoxiously louder than life personality, but that's not why he was successful. It was the result. All these people that have signed their posters behind dedicated to Andrew, there's a reason why he was successful. And passing on that knowledge, working with him for almost 11 plus years and working alongside him, doing seminars, I think that has been the focus. And that would be the future focus moving forward, passing on that education and knowledge to people in future. So looking out for some few seminars coming ahead, and you've been helping me with some of the seminars, so you're going to be involved in those as well.
Absolutely.
The mentoring, I think you're going to be involved in that as well. So I think the education moving forward a little bit more for me, the focus, because that's where I see most of the demand coming for me.
Yeah, and so important.
Yeah.
So important.
All right, shall we wrap this one up?
Episode 1 in the bag.
Episode 1 in the bag.
Thank you for watching. How long was that? That was a long time. Man, that's